Good afternoon, everybody. I'm Sayukta from beautiful Spotless Skin team. I'm sure all of you must be keeping good health. Misuse of topical steroids is a widespread phenomenon among young people in India, especially women. Viewers, as you know, many people are using cosmetic products, mostly fairness creams, without even knowing that products contain steroids and assuming that they will get fairer and have a glowing skin. But they do not know that inappropriate use of steroids may cause severe side effects. According to a study done in 12 Indian cities, found that almost 60% of all patients who had skin problems on their face were using creams containing steroids without any prescription. Side effects of this abuse were seen in the form of growth of facial hair in women, worsening of pimples, whitening of or thinning of skin, causing severe sensitivity to sunlight. The practice is associated with significant adverse effects and poor awareness of these effects among the general public. To keep you informed, today we are here to know about how to make us aware about misuse of topical steroids from an expert. So let's connect today with our skin expert, Dr. Ankita Jaju, live from Aurangabad, Maharashtra. Dr. Ankita Maheshwari Jaju is a board certified dermatologist. She has done post-graduation diploma in dermatology, venerology, and leprosy from the most renowned State College and Hospital, Mumbai. She has treated 30,000 plus patients successfully and performed 5,000 plus procedures during her training period. She has started Jaju Skin Clinic in Aurangabad, Maharashtra for serving the society with the best of her knowledge and skills. Her mission is to deliver best skin treatment to all those who could never afford it. Today, Dr. Ankita Jaju will speak about the misuse of topical steroids or rising alarm for misuse of topical steroids. A very warm welcome to you, Dr. Ankita. Hope you're doing good.
Thank you. Thank you for such a warm welcome.
Great. Today, as we are going to talk about a very sensitive issue about topical steroids, tell us why we are not supposed to use cream or formulation containing topical steroids. What are the different reasons?
See, it's not like that you are not supposed to use topical steroid. You can use steroid provided they are prescribed by your dermatologist, your doctor. Since we are talking only about topical steroids, I'll stick to topical steroid like cream based. There are steroid available in injection form. There are steroids available like in tablet, and there are steroids in cream form, lotion form, and ointment form. So today we are talking only about topical steroids, that is cream, lotions, and ointments. So you can apply steroids provided they are prescribed by your doctor for your skin concerns.
Why?
Under his or her guidance.
Right. And that's why we always say that in case you have any skin related issue or you need to have a good suggestion about what to use, what not use, please go and contact your dermat so that they can, prescribe or advise you about what to use. Don't just go and buy things which can be really bad for your skin. Doctor, we would also like to understand why facial skin is more vulnerable by misuse of topical steroids.
First thing, as compared to other area of the body, facial skin is thin, more absorption of the steroid, so it's more prone to the side effects. Second thing, there are more sebaceous gland over the skin of the face, so there is more absorption. And third thing, obviously, when you are misusing it, you are using the steroid, which is not supposed to be used on the face. You are using more potent steroid, so you should so that obviously there are side effects could be more on the face.
Okay. And which are the common side effects observed due to misuse of steroids?
Hypopigmentation, that is your skin gets white. Initially, this is the main reason for which people misuse steroid. They feel they are getting fair, but eventually they are getting like hypopigmented. The skin is getting white. There will be atrophy, or in simple language we can call skin thinning. Then you can get stripe, that is nothing but a stretch marks. There can be dermatitis to the content in the steroid. There can be facial hair growth also.
Okay. Mhm. And what are the common examples of topical steroids?
See, there are different types of steroids. So the most misused one are the most potent or a super potent topical steroid. They are like clobetasol, halobetasol, triamcinolone, fluticasone, and mometasone. These are the potent ones which can give you like adverse effect very early.
Right. So these are the most potent steroids that we are, using, and it's actually spoiling our skin or the quality of our skin. Doctor, in our society, we have this frenzy, we have this obsession for a fairer skin. We all feel that, the whiter it is, the better it is. Thus, we have this tendency of going and applying buying fairness creams and applying it regularly for years and years. How safe these fairness creams are?
Totally depend the content of the fairness cream which you are using.
Mhm.
First thing, I will say that you should go behind healthifying your skin rather than going for fairer skin. And second thing is you have to accept whatever it is. It's genetic. Your color is decided by your genes. So
Exactly.
fairer cream as it totally depends on the content which fairer cream you are using. There are a lot
Mhm.
of fairness cream available in the market. Most of them, like they are prescribed by the medical persons. They are not fairness cream, but they promote it as a fairness cream, and they have steroids.
राइट तो इसलिए ये समझना बहुत जरूरी है कि हम सब अलग है, हमारी स्किन अलग है और यही तो हमारी खूबसूरती है। तो सब क्यों सिर्फ एक ही कलर के पीछे भागे, और ऐसा किसने कहा है कि जो जिनकी स्किन वाइट होती है उनकी स्किन ज्यादा अच्छी होती है या उनका अपीयरेंस ज्यादा अच्छा होता है। तो इसलिए ये जो एक ऑब्सेशन है फेयर स्किन को लेकर, ये भी कम करना बेटर होगा। और जैसा डॉक्टर ने कहा कि हेल्दी स्किन होना, ग्लोइंग स्किन होना, ये ज़्यादा अच्छा है। हम क्यों ना अपनी स्किन की हेल्थ पर काम करें रादर देन उसे बुरे बनाने की कोशिश में हम अपनी स्किन को ज़्यादा अब्यूज़ करते रहें। डॉक्टर, व्हाट आर द रीजंस फॉर यूजिंग टॉपिकल स्टेरॉइड्स?
See, first of all, I'll classify the use of steroid in two ways. One is therapeutic use, prescribed by the doctor for your condition. Second thing, misuse. So the
हुँ,
misuse can be by the people or the doctor who don't have the complete knowledge of the topical steroids.
हुँ,
Second thing is misuse by the medical store people
हुँ,
who themselves dispense it. And the third is by the patient themselves. I
ओके।
have seen patient, it's very easy for them to go in the medical and buy and ask them. Then even if they approach to the doctor, they follow it for some time and then afterwards they continue it on their own. That is
हुँ,
also wrong.
हुँ,
Second thing is even after stopping the treatment, they get better. After say 6 months or 1 year or any time in the life, if the things again come to they get same problem, they again
हुँ।
use the same medicine without the like prescription or without the consultation. So these are the reason basically for the misuse of the steroids.
राइट। डॉक्टर, वो कौन-कौन सी क्रीम्स इन जनरल होते हैं जिनमें स्टेरॉइड्स होता है? लाइक बहुत जनरल अगर हम बात करें तो डेली हम फेस वॉश यूज़ करते हैं, मॉइस्चराइज़र यूज़ करते हैं, सीरम्स यूज़ करते हैं, सनस्क्रीन लोशंस यूज़ करते हैं। कई लोग जैसा कि हम बात कर चुके हैं कि फेयरनेस क्रीम्स भी रेगुलर बेसिस पे यूज़ करते हैं। कई लोग हैं जो एक्ने या पिंपल्स की प्रॉब्लम से गुज़र रहे होते हैं और वो भी डॉक्टर के पास जाने की बजाय केमिस्ट के पास जाते हैं और ओवर द काउंटर क्रीम लेके अप्लाई करते हैं। तो ये जो तमाम एक डेली रूटीन में जिन्हें हम इस्तेमाल में लाते हैं, इनमें से कौन-कौन से में स्टेरॉइड्स हो सकते हैं या होते हैं?
To be honest, किसी में भी steroid नहीं होता है.
हुँ,
Neither
हुँ,
your daily cream, no,
हुँ,
neither your body moisturizer, sunscreen, even acne treatment. I can say yes if you are not taking it from a dermatologist, like relying on your relative or a medical store person, then there are chances for acne. You can like you are prone to like get steroid.
हुँ, हुँ। You can end up buying a
Yes,
steroid based cream
yes,
without even knowing कि इसमें topical steroids है.
बिल्कुल.
तो क्या हमें ध्यान में रखने की जरूरत है? What are the things that we really need to be careful about, right? Because we are here talking about the misuse of topical steroids, or using topical steroids without prescriptions, without going to the doctor, etc. So where we stand the chance of without even understanding, buy a steroid and start applying it. कौन से प्रोडक्ट्स हैं जो हम यूज कर रहे हैं या कर सकते हैं?
See, first thing, the patient steroid कब लगाता है? First thing, he has, जैसे हम first we discuss about acne, pimples. Second thing is if he has any hyperpigmentation over the face, then he may land up like going to medical store and buying steroid. Third is very common, patients suffering from fungal infection. They have this habit of going to the medical and buying steroid containing creams and using it because it gives you the instant relief.
Right. But do they actually go to the chemist and say that I need some steroid based creams, or they just say that I have a fungal infection, give me a cream which can, which is antifungal, steroid based
Both the scenarios are possible. If they are if they are going for the first time, they'll just go and tell their problem, and the medical store person will give. If they already have such cream, they're already using it, they'll just go and show the cream and tell that I want the similar one.
Right. Yeah, it happens a lot. And again, because these days, apart from the chemist or a family of or a friend who's a cream person normally uses in their condition, we also have influencers or people who are in a way promoting various kinds of creams or lotions, etc. Now, again, is this increasing the chances of selling of topical steroids, or the phenomena of buying steroids?
I would say no, because whatever influencers or what you are talking about, I have seen. I have not seen anyone promoting steroids, topical steroid containing any cream. So I would say no. They are promoting, they are cosmetic brands, basically creams, cold creams, moisturizer, sunscreen, face washes. It's okay. Don't have steroids.
Okay, fair enough. And now, what is the harm that these steroids can cause us? What harm can they do to us?
As I mentioned earlier, there can be hypopigmentation, there can be atrophy, skin thinning, there can be stretch mark, face seen. Now these are the topical side effects, but once the duration of your application increases, there could be systemic side effect as well for steroids, and there are very dangerous one, I would say. Your face can swell. It's basically called moon face. There could be stripe all over your body, axilla, or basically everywhere. And the stries are very, dangerous looking, very red. The skin is very thinned out. The blood vessels can be seen through the thin skin. There can be patient can be hyper irritable. Irrelevant talk can be there. So, and if you give in pediatric age group, there can be growth retardation. Around the eyes, there can be glaucoma. And eventually, the systemic side effect can lead to osteoporosis.
Okay.
So you have to be very careful.
Right. तो ये समझने की बहुत जरूरत है कि जिस तरह से उस क्रीम को या टॉपिकल स्टेरॉइड को यूज करने के लिए कहा गया है, पहली चीज तो कि वो प्रेस्क्राइब्ड हो, वो आपको डॉक्टर ने दी हो। दूसरा कि उसका यूसेज भी, जो डोसेज कहा गया है, जिस तरह से जितना लगाना है उतना ही लगाया जाए। अगर 30 या 50 ग्राम का क्रीम है और उसे एक ही दिन में आप खत्म कर रहे हैं, देन ये जितने भी साइड इफेक्ट्स या हार्मफुल इफेक्ट्स डॉक्टर ने बताए हैं, ये होने के चांसेस आप बहुत ज्यादा बढ़ा रहे हैं। यू आर अब्यूजिंग योर स्किन लाइक एनीथिंग। प्लीज डोंट डू दैट। कई बार ये होता भी है डॉक्टर, स्पेशली जैसा आपने कहा एक्ने के केस में, पीपल टेंड टू गो टू द केमिस्ट, आस्क फॉर एन ओवर द काउंटर क्रीम, और वो कई बार स्टेरॉइड बेस्ड होते हैं, और चूंकि एक्ने कंट्रोल में नहीं आते हैं तो उन्हें लगता है कि हम बहुत ज्यादा लगाए। अगर केमिस्ट ने बोला भी कि दिन में 2 बार लगाना, तो वो दिन में 5-6 बार लगाते हैं। और चूंकि उसके रिजल्ट इमीडिएटली बहुत अच्छे दिखते हैं, तो उनको लगता है अरे भाई ये तो वर्क कर रहा है, वर्क्स लाइक अ मैजिक। लेकिन वो मैजिक जो है बाद में समझ में आता है कि उसने कितना नुकसान है। अगेन एक सिचुएशन ये भी होती है कि हम डॉक्टर के पास गए, हमें जो भी इश्यूज है हमने बताए। डॉक्टर्स ऑल्सो डू प्रिस्क्राइब टॉपिकल स्टेरॉइड्स, राइट? लेकिन वहां ये बेटर, क्योंकि डॉक्टर ने पूरा पढ़ाई किया हुआ है, वो आपकी कंडीशन को, एक पेशेंट की कंडीशन को समझते हैं और उस हिसाब से वो देते हैं उसका डोसेज। लेकिन कई बार पेशेंट डॉक्टर को दिखाकर आ गए, 1 महीने का ट्रीटमेंट ले लिया, फिर अगर उनको प्रॉब्लम हो रही है तो they'll go again with the same prescription, or they'll keep on applying the cream without even telling the doctor कि वो क्या कर रहे हैं। डॉक्टर को लग रहा है कि okay, the treatment is over, they are not using it anymore, but actually the patient is again using the same cream again and again. ये कितना harmful हो सकता है?
Yeah, first thing I'll start with, I always say steroid is a double-edged sword. Okay. At the one end, it can be life-saving. At the other end, it can take your lives too. So, sticking to topical steroid, yeah, it's again double-edged sword. Initially, when you apply for, say, pimples, acne, or pigmentation, you will see great results. That you get addicted. You want to apply that cream. But
Right.
after a month or so, it is like if you don't apply the like steroid, you get you are dependent on it. Your condition will worsen. And if you apply it, then also it will worsen. So it's a double-edged sword.
Exactly. So that's the, misuse of topical steroids we are talking about. And now, doctor, if a person comes to you और आपको पता चलता है कि उसने actually without prescription topical steroids use करके अपने skin के साथ abuse, what's the line of treatment that you as a doctor take?
The first thing, counseling is very important. So I need to counsel her for what thing she has used, which steroid she has used, and for how long she has used. I have to ask all, take the detailed history, and then counsel her. And depending upon the side effects, see, some side effects are reversible, some are irreversible. So I need to counsel accordingly. See, okay, this can be like they can be reversed, but this they are difficult to reverse, or they may take time, say in years.
Okay.
Yeah. So basically, if patient has come, see, there are different scenarios. Many times patient, they are in a there's a condition called exogenous Cushing syndrome. So that is because of the steroid abuse, systemic side effects ho jata hai. That case, you can't suddenly withdraw steroid, you can't suddenly stop the steroid. So in that case, you have to continue a very small dose of steroid for a longer time and then slowly taper it. And completely depends upon patient to patient how much he has used and what are the severity of side effects the patient is having presently. So this was the one scenario. If he has only topical side effects, then I stop this steroids and I just give him moisturizer and sunscreen.
So that's also a way, to tackle the problem. If someone has used topical steroids and the problem persists topically, then they can actually start using sunscreen and moisturizer on a stop using those topical steroids as soon as they understand that they are harmful. And do that. Don't self-medicate. It can be really dangerous. Don't go for over-the-counter medication. It can be really dangerous for your skin. Doctor, what are the other, problem that as a doctor you face when people come to you and say that they have actually used topical steroids without prescriptions? और क्या-क्या issues सामने आते हैं?
Topical steroid, firstly, they use for instant relief. I have seen many patients, they know that steroid is not going to help them. They are using wrong cream, but still they use it because it gives them an instant result. And this is the basic reason they're fond of using steroid creams.
राइट। और कई बार तो ये होता है, मान लीजिए मुझे एक्ने की प्रॉब्लम है, मैंने ओवर द काउंटर कोई क्रीम लिया जो कि स्टेरॉइड बेस्ड है, मैंने लगाया, मुझे अच्छे रिजल्ट्स 10 दिन के बाद दिखे, तो आई टेल माय फ्रेंड कि मुझे तो बहुत अच्छा हुआ, तुम्हें ये प्रॉब्लम है, तुम भी स्टार्ट कर लो। तो हो सकता है दूसरे ने ये सुनकर कि ओके, मतलब उसको तो बहुत फायदा हुआ, तो मैं भी यूज करके देखती हूँ, वो भी यूज करना शुरू कर देते हैं, और जब तक उनको अच्छे रिजल्ट्स मिलते हैं, तो जो पहला पर्सन है उसकी स्किन की कंडीशन जो है खराब होनी शुरू हो जाती है, बट दे डोंट रियलाइज दैट व्हाट आर दे डूइंग विद देयर स्किन एंड अल्टीमेटली द हेल्थ ऑफ देयर ओन, सो डोंट रिस्क इट, इट्स नॉट वर्थ, सो प्लीज गो एंड कंसल्ट योर डॉक्टर इज द बॉटम लाइन ऑफ द होल सेशन। बार बार हम यही कह रहे हैं, स्किन से रिलेटेड कोई भी इशू है, प्लीज गो एंड कंसल्ट योर डॉक्टर। अगर आपको स्किन कलर को लेकर भी कोई इशू है, क्योंकि फेयरनेस क्रीम हम लोग बिना किसी से पूछे लगाना शुरू कर देते हैं, अगर आपको उसमें भी इशू है, तो प्लीज गो एंड कंसल्ट योर डर्मेटोलॉजिस्ट, वो सही से आपको सजेस्ट करेंगे। हो सकता है बहुत हेल्दी स्किन केयर रूटीन आप अपनाएं, तो भी इन प्रॉब्लम से आपको निजात मिल सके। तो डॉक्टर, बहुत असल में हम इस पर भी बात करना चाहेंगे, वो इश्यूज जिसकी वजह से लोग स्टेरॉइड, टॉपिकल स्टेरॉइड्स यूज करते हैं, उसको किस तरह से कॉम्बैट किया जा सके। लाइक हाइपर पिगमेंटेशन इज वन बिग प्रॉब्लम, melasma is one big problem in our society, especially with women. They do have melasma or freckles or patches on their skin or hyperpigmentation, और डॉक्टर के पास जाने की बजाय वो खुद से ही मेडिकेशन लेना शुरू कर देते हैं। तो क्या करें अगर पिगमेंटेशन, हाइपरपिगमेंटेशन, melasma, पैचेस ये प्रॉब्लम है?
The first thing, if you have melasma or hyperpigmentation, one thing, you have to use your sunscreen very religiously.
Okay.
9, 12, 3 p.m. You have to use thrice. Okay. Sunscreen is the best thing to avoid further increase of the pigmentation or further increase of melasma. And second, depending upon the pigmentation, how deep it is, your dermatologist will prescribe you the depigmenting cream.
Right. So if you're suffering from hyperpigmentation or melasma, etc., please start using sunscreen lotion in the right way with the right quantity. Reapplication is equally important. And then go and please contact your dermat so that they can understand the reason, the cause, and then start treating you. We'll also take some of our viewers' questions, Doctor. Ria Santosh Mehra is asking, मैम क्या स्टेरॉइड्स स्किन को और ज्यादा डैमेज कर सकते हैं अगर मेरी स्किन में पहले से पिंपल्स या मार्क्स हैं?
Yes, obviously, steroids gonna damage your skin. If you have acne, pimples, you should not use steroids. Strictly no.
राइट। एक आम आदमी के लिए ये समझ पाना मुश्किल होता है कि वो जो खरीद रहे हैं वो स्टेरॉइड्स है या नहीं है। क्या वो कुछ ऐसा कर सकते, एक छोटा सा R&D रिसर्च जो खुद के बेसिस पे मोबाइल पे गूगल करके, जिससे वो पता कर सके कि एटलीस्ट जो वो खरीद रहे हैं उसमें क्या कंटेंट है, क्या इंग्रेडिएंट्स है, क्या ऐसा कुछ किया जा सकता है?
Yes, abhi nowadays the people like search Google everything prior to
Right.
coming to a doctor. So similarly, at least they should make a habit that they are searching what like they are buying. They should search the contents.
Right.
But there are मतलब इस चीज का एक अलग साइड इफेक्ट्स भी है कि फॉर देयर आर कंडीशंस वेयर स्टेरॉइड इज रियली नीडेड. सो एट दैट मोमेंट ऐसे हो जाता है, पेशेंट इज लाइक मैम आपने तो स्टेरॉइड दे दिया है, स्टेरॉइड्स के तो बहुत साइड इफेक्ट होते हैं ऐसे. सो एज आई सेड, स्टेरॉइड इज अ डबल एज स्वॉर्ड and steroid is needed whenever you have some dermatological or skin conditions. As if you properly get consultation with your doctor, he's in a right position to say whether steroid is required for you or not. The aim of this live is not to create fear among the public. It is just to alert them, aware and educate them about the misuse.
Exactly. The irony is many times people won't visit a dermatologist saying that वो तो steroids prescribe कर देंगे, और वो ये समझते भी नहीं है कि वो खुद जाकर जो क्रीम एक्चुअली लेकर आ रहे हैं वो भी स्टेरॉइड बेस्ड है। तो डॉक्टर और खुद से मेडिकेशन करने में ये डिफरेंस आ जाता है। दे नो कि वो क्रीम क्या है, कितना यूज करना है, कब तक करना है, आपको आपकी कंडीशन को वो समझते हैं। लेकिन जब आप खुद से कोई चीज लाकर apply कर लेते, especially अगर वो topical steroids है, that ultimately you are actually, harming your skin. So that's the difference, and that's why we are continuously saying, please go and consult your doctor before buying anything, and especially before buying anything steroid based. So that's the difference. We have Shalini with us asking, how does skin get addicted to steroids?
See, addiction, I'll explain this in a similar way like you get addicted to alcohol. शुरुआत में ऐसे होता है कि एक मोमेंट पे एडिक्शन जब आप छोड़ोगे तो भी उसके विड्रॉल सिम्टम्स आते हैं. Similarly is the case with steroid. If you are applying it for long term and then you suddenly stop it, your skin reacts more. It becomes sensitive. Or ज़्यादा, for example, if you are applying it for pigmentation, after initially you will get a very good results. You will be very happy, but eventually, say after 1.5 or 2 months, you won't see any improvement. But even after stopping, you will see more of pigmentation. So even if you apply it or leave it, the condition will be same.
Okay, right. Akash Singh is here asking, how dangerous are steroids-based skin color lightening creams?
See, if you are totally, as I said, there are 7 types of classes of steroid, like ranging from very mild potent to very super potent. It totally depends कि इनमें से कौन से क्लास का स्टीरॉइड उस क्रीम में है and for how long you are applying. Definitely, if you are applying it without consultation of a dermatologist, it's harmful.
Right. Priya Sharma is asking, why can't we use steroid cream for more than 2 weeks at a time? Surely it won't dry out our skin because it's a lotion.
See, just because it's not drying out, it's not the indication you should use steroid. Exactly. There are moisturizing lotions available in the market. You go for it.
Exactly. But in case you want to use a steroid based cream, please go and consult your doctor and do use only as prescribed. Shivendra Singh is asking, how does the skin get addicted to steroid creams? I think we have already covered it. We have already discussed it. Kalpana Jadhav is asking, is there a safe amount of steroid?
It again depends. As I said, there are classes of steroids, right from like lowest potency to super potent. It also depends upon where you are applying, whether you are applying it on a normal skin or whether you already have some skin diseases, you have some lesions on your body, how they are. It totally depends upon that. So accordingly, your safety profile will be decided how much amount you can apply or how long.
Right. So when you'll go and discuss your issue or your skin condition with your dermat, they'll actually, tell you how to use the cream and when to use it, when for how long to use it. तो वो सब आपको बताएंगे. बस जरूरत इस बात की है, A, हम डर्मैट से मिले, उनसे बात करें, उनको अपनी स्किन कंडीशन बताएं. B, जो डर्मैट कह रहे हैं उसी हिसाब से हम उन क्रीम्स का इस्तेमाल करें. Over the counter self medication ये नहीं करना है. That's what we are continuously trying to tell you.
One thing I'd like to add here.
Yes, doctor.
Side effect, everything totally depends upon your age, site where you are applying, amount you are applying, frequency, दिन में कितनी बार, amount you are taking, and the basic skin condition for which you are applying it. So group together this, safety profile can be decided.
Right.
And this of course, what a dermatologists do, and that's why we always recommend that you always apply topical steroid under the guidance or under the prescription.
Exactly. इसीलिए बार बार कहा जा रहा है कि स्किन से रिलेटेड कोई भी इशू है, सेल्फ मेडिकेशन ओवर द काउंटर मेडिकेशन करने से पहले डर्मैट को जरूर दिखाएं. Shruti Vastav is here asking, my question is, ma'am, that how long can I take steroids safely if I'm having dry skin?
See, I said it earlier also. If you have dry skin, you need not to apply steroid. You go for a good moisturizer.
I think a lot of misconception is there
Yes,
among people.
steroid is not for your dry skin.
Right. But the amount of questions on the same line that we are getting from our viewers, it looks like a lot of misconception is about here. I mean,
Yeah.
prevailing among people, and they feel that they can actually deal with the dry skin with the help of the steroids. To clarify that, doctor, can you recommend a simple skincare routine that a dry skin people or people with oily skin or people with normal skin can follow, so that they can understand that there can be easy and healthy way of keeping your skin healthy?
Yeah. First thing I'll start with use a face wash or a soap. If you have a dry skin, avoid using soap face wash. Go for a mild cleansers, gentle cleansers. Then in the morning, you should always use a moisturizer. It's
Mhm.
good if you wish to use a vitamin C serum, you can use it. No harm. Vitamin C serum followed by a moisturizer. If you have a dry skin, no issues. You can use any moisturizer. But if you have a oily skin or a acne prone skin, make sure that you are buying non-comedogenic moisturizer. Otherwise, your acne can aggravate.
Right.
And if you have a oily skin, then you may get acne or you may feel very discomfort and stickiness and oiliness throughout the day. Post moisturizer, never skip your sunscreen.
Mhm.
You should apply your sunscreen. Uh, Even if you are indoors, even in rainy days, and then eventually you should in the evening after coming to home or whatever you are working, coming to home, after washing your face, always apply a good night cream or a moisturizer. If you are 30-35 above, apply a good anti-aging night cream, or below 30 you can just use a good moisturizer only.
Right. तो एक बहुत सिंपल स्किन केयर रूटीन है जो आपको अपनाना है ताकि आपकी स्किन हेल्दी रहे। एक जेंटल क्लिंजिंग मॉइस्चराइजर इज अ मस्ट, लेकिन हाँ डेफिनेटली अलग अलग स्किन टाइप के हिसाब से अलग अलग मॉइस्चराइजर हो सकता है। स्किन सनस्क्रीन लोशन इज रियली इम्पोर्टेंट, रीएप्लीकेशन इज रियली इम्पोर्टेंट, द अमाउंट दैट यू आर अप्लाइंग इज रियली इम्पोर्टेंट। सो सनस्क्रीन को लेकर अगर फिर से कोई डाउट है तो प्लीज गो एंड कंसल्ट योर डर्मेटोलॉजिस्ट। They can, as per your work routine or your skin type, they will suggest a good sunscreen to you, क्योंकि यही हमें सबसे ज्यादा लगाना है, रोज लगाना है, बार बार लगाना है। In the meantime, Samar Singh Kushwaha is here asking, ma'am, is paper thin skin achievable without consuming steroids?
Yes, there are other reasons also that you can get thin skin.
Right. And the way Summer you have used achievable, I thought that there's some sense of achievement in getting a thinner skin. So the whole issue is that please avoid over-the-counter steroids or self-medication or abusing your skin with steroids. So in case you have an issue, please go and consult your dermat. सुहाना मलिक पूछ रही है कि मैम साइड इफेक्ट्स के बारे में बता दीजिए स्टेरॉइड्स यूज करने के। हालांकि इस पर हम बात कर चुके हैं, लेकिन सुहाना या ऐसे दूसरे जो हमारे व्यूअर्स हैं जिन्होंने अभी अभी ये सेशन देखना शुरू किया है, उनके लिए एक बार आप बता देंगे डॉक्टर कि किस तरह के साइड इफेक्ट्स हो सकते हैं।
जहाँ पे भी आप स्टीरॉइड, टॉपिकल स्टीरॉइड लगाते हैं, कुछ दिन के बाद वहां पे आपको व्हाइट पैचेस, हाइपोपिगमेंटेशन दिख सकता है, थिन स्किन हो जाती है, किसी एट्रोफी ऑफ स्किन, स्ट्रेच मार्क्स, ड्राई दिख सकते हैं, हेयर रीग्रोथ हो सकता है उस जगह पे, रेडनेस हो सकता है उस जगह पे, एक्ने आ सकते हैं, and these are the skin side effects or topical side effects, I would say. And if the frequency and the duration still continues, you still keep on applying the steroid, then you may land up in the systemic complications of steroid also. That can be weight gain, swelling of the face, there can be like mood swings, psychosis, all these things, osteoporosis.
Exactly.
Yeah.
Another question from Maya saying, can I use moisturizer after steroid cream?
I'm not understanding why all these questions and why you want to apply steroid cream.
Exactly. I mean, if your doctor have prescribed you, then I'm sure that your doctor must have told you what to use, when to use, and what to use after that, particular cream. Nobody is going to say कि सी ये स्टेरॉइड है, इसे सुबह लगाओ और उसके बाद क्या करना है हम नहीं बताएंगे. ऐसा कोई नहीं करता है. तो why are you even using steroid cream if your doctor have not prescribed it? तो definitely. और जिस
I
तरह
would
से
like to
questions आ रहे हैं, that's really an alarming situation.
वन थिंग आई वुड लाइक टू से हियर, इवन आपने टीवी पे या जहाँ पे भी जो भी मीडिया सोशल मीडिया है, आपने कभी देखा है कि कोई स्टीरॉइड के लिए मार्केटिंग कर रहा है?
Exactly.
नो वन. They'll do for face wash, moisturizer, sunscreen. Then why you want to apply steroid?
Exactly. I don't think अगर मैं मार्केट में जाके बोलूं मुझे एक स्टेरॉइड क्रीम दे दो तो कोई दे देगा, क्योंकि ऐसा कुछ होता नहीं है. There are basic various kinds of steroid, उसको बेस करके अलग-अलग फॉर्मुलेशंस होते हैं. तो बाकी मैं जिस तरह से क्वेश्चन स्कोर किए जा रहे हैं, now I'm understanding the importance of this session because people are unknowingly using steroids on their face, and now I'm sure they are facing some issues with dry skin, etc., and that's why they are pouring questions about the dryness of the skin.
There are
So,
many misconceptions with respect to steroid. Like as I like in the question, I could see like for dry skin.
right, you're right. So people, again, please don't use steroid-based creams on your own. Go and consult your dermatologist. और अगर किसी भी क्रीम के इस्तेमाल से आपको साइड इफेक्ट्स हो रहे हैं तो प्लीज डर्मेट के पास जाइए, खुद से उसे ठीक करने की कोशिश मत कीजिए. Okay, Saloni Mehra is asking, what vitamins contain steroid?
No vitamins contain steroid.
I don't think any vitamin contains steroids. I think a lot of misconception is there. So people, please, in case you have any issue, go and consult your doctor, your dermatologist, a qualified dermatologist in this case. And doctor,
no one will prescribe vitamins if vitamins contain steroid. Why will doctors give vitamins, multivitamins to the patients if they have steroid? Why doctor will give unnecessary steroid to any patient?
Exactly. And doctor, before we sum up the whole session, because now, even you must have understood that a lot of misconception is there with steroids, or people are not aware that well about steroids. Any take-home message for our viewers or anything that you would like to share with us?
Yes. First thing, as repeatedly said by you and by me, that do not self-prescribe steroid. First thing, always consult the dermatologist. And one thing more, if you have some skin dermatosis, then there is a way to stop the steroid. Directly, you can't stop steroid. There is a lower, what I say, पहले आपको अगर सुपर पोटेंट स्टीरॉइड दिया गया है तो बाद में आपको लो पोटेंसी, देन अगेन लो एंड देन लोएस्ट, ऐसे करके ही स्टीरॉइड को विड्रॉ किया जाता है इफ यू आर यूजिंग इट फॉर लॉन्ग टर्म. सो डोंट, if you are taking it for any skin condition and if you suddenly stop that steroid, you will find that जब तक कि मैं क्रीम लगा रही थी तब तक के सब अच्छा था, suddenly मैंने जैसे ही क्रीम बंद किया and suddenly I got that again. So there is a proper way to stop it. So there are follow-up visits.
Right. इसीलिए हम बार बार कह रहे हैं कि प्लीज अपने डर्मेट के पास जाइए, क्योंकि स्टेरॉइड सही तरह से इस्तेमाल किया जाना बहुत जरूरी है. सही समय तक और किस तरह से यूज करना है, कब यूज करना है, कब तक यूज करना है, ये सब आपको एक qualified dermat ही बता सकते हैं. Please don't harm yourself, don't harm your skin, and please visit your doctor in case you have any issues. Thank you so very much, Dr. Ankita Jaju, for your valuable time. It has been a very informative session for our viewers, and it was great to hear you. Thank you so very much.
Thank you.
We really look forward for many more such sessions for our viewers in coming times.
Thank you very much.
And viewers, thank you for your active participation in today's session. If you want to consult Dr. Ankita Jaju, you can visit to Jaju Clinic opposite HDFC Bank near Shivaji Nagar Petrol Pump, Sulgani Chowk, Aurangabad. For more updates, you can also visit to their website www.jajuclinic.com and stay connected to our beautiful Spotless Skin page. Thank you. Have a great day ahead. Goodbye.
Like, subscribe, and press the bell icon. Thanks for watching.